Yep, we're on.
There is no warning, bro. You hit go live. Before I used to have a few seconds to put on my makeup, but that has since gone away. Facebook changes a lot and frequently. You notice that?
Yep.
So anyway, what's up, Charles?
Nothing much, brother. How are you?
Ah, doing well, doing well. Aside from my finger, if you can see my finger, I slammed it in the kitchen door in my rush to go to work this
Ooh.
morning. And I thought it was just you know how you bang, you smash your finger, you get the sore, but then when I look, it was bleeding, so I had broke skin. So and not one band-aid in the house. So
Oh,
paper towel, and scotch tape, bro. Paper towel and scotch tape. So anyway, no more pain though, but it's just it's a pain in the butt. Anyway, guys, Dr. Lee Altenberg tonight.
mhm,
Smart guy, well versed in the topic. He's going to talk to us about all kinds of stuff.
right.
Much of what you guys have been asking. I know. Charlie and I receive a lot of questions every single day. We try to answer what we can. We send some of you to locations or resources to get your answer. But hopefully tonight, Dr. Lee will share with us some troubling times, Charlie, right now. Some troubling times. And again, I don't like keep saying it, but I just gotta be honest that we look at our numbers. And first of all, that 14 Kauai cases at the state report is not sure where they got that from, but we had two more today. We got the UK variant now on Kauai, and it's not getting better. And well, when you watch the news in the morning, all you hear about how good we're doing and that we should be at herd immunity soon. We're reading articles from around the country that is now MIT did a study that's saying that guys not showing up for the second, or I think it was MIT, not showing up for their second shot. So herd immunity is not as close as some would like us to believe. But at the end of the day, I mean, again, it's us. We got to be careful. We got to be safe. But the numbers continue to rise, especially here in Kauai, and that is concerning. Very concerning.
Yeah, yeah. Um, I don't know, boy. It's so many things are happening, but they're saying now too that social distancing. MIT was the one that did the study.
Oh, sorry. It was
Yeah,
MIT that did that one. I'm sorry. I misspoke. MIT did that one.
social
Can't remember
distancing.
who did.
Yeah,
Yeah, sorry.
yeah. They said that the social distancing, whether it's 6 feet or 60 feet, doesn't matter because it's all about the droplets, right? And they even talk about the face mask because the face mask usually, when you exhale, it usually goes up and then down. So there's so many things that's being said, and it's a tough call. But like I said today, it's all a matter of how safe do you want to be. If you feel if you feel you're in control of yourself and you got nothing to worry about, then hey, nobody can stop you. But all I ask is show a little compassion for your fellow man. Then because one thing, getting the vaccine, what it doesn't do to you, it doesn't give you the ability to predict, right? If you get the vaccine, if you're walking on a sidewalk and someone's coming towards you, it cannot give you the power of prediction to determine whether that person is vaccinated or not, right? And you what happens to you is that You may be having a tag along, a an infectious variant might be tagging along for the heck of it, and it decides to jump when you pass each other. Who knows? I mean, I don't even know how this thing transmits from a person. I can imagine that with enough exhalation when you're talking to someone, they get it that way, right? But again, getting the vaccine does not give you that ability to predict what's coming towards you. If it did, it will tell you who to avoid. You get this little alarm go off in your head, says, okay, alert, alert, non-vaccinated person coming. Then then you take a detour. But it doesn't do that. So you feel confident because you've been vaccinated. You walk as if no real biggie, and that's when problems start.
Well, we're seeing the spread. I mean, we're seeing the spread here on Kauai. And again, I'll say it again, Kauai is the only place uh, that gives you real time numbers. We're the only county that does it. So, and it's troubling. It's troubling. I know I see a couple of posts about the 14. We don't know how they got the 14. It's not true. We didn't have 14 cases today. And you remember the state's numbers are 2 days late. So the numbers that report today on Monday is from Saturday. So on Saturday, what did we have? 4?
Well, it said the report was uploaded. It was reported on Saturday, so that's what the article said.
Mm.
So
Yeah. So
you know,
it's I don't care. It's not accurate. The 14 is not accurate. So we had 2 today. We had, I can't remember. Yeah, just but it's not 14. And again, that's why I don't post the state's numbers on my page because you cannot trust it. You just cannot. You can't. The only numbers I trust is the Kauai numbers because we get it real time and we get it daily. Whenever a case is identified, the county puts out a press release. So that's the only numbers I feel comfortable with. The Honolulu numbers, or I'm sorry, the state's numbers. I don't. I don't honestly do not trust whatsoever, and we still don't know what the cases are across the state for each county, like Kauai does. So why can't everybody do the same thing? I don't know. I do not know.
mhm.
So tonight gonna be interesting. Dr. Altenberg. I don't know if you've heard him before. We've seen him on. I mean, he's been on our show, but he's also been on numerous newscasts, sharing his expertise. Shar says H Hawaii News Now at 6 reported that we had 16 again.
Yeah.
Uh, so Dr. Altenberg again, and he just popped in our waiting room. We'll bring him right in. But yeah, guys, again, the questions, you know, let's listen to his presentation first. I don't like to interrupt him because, he has a lot. This guy is smart and he knows this field. And so I'm about ready, Charlie. You?
Yep, I'm ready.
Let's bring him in and give him a Kauai welcome. And there he is. Welcome back, Doc. Welcome back.
Aloha. Thank you for inviting me.
Well, it's always an honor and we're just honored to have you on. I think and of course Charlie and our viewers are. Before we get started, people, now is the time. Now is the time. Hit that share button. We're gonna have some fun discussion tonight on a not so fun topic, but we're gonna try to get as much information from you, Doc, as possible. Lots going on. You see, Kauai just got our UK variant identified today on Kauai. We had the California variant like about a week ago. The last time you were on the show, you talked about the dangers of the variants. All of the experts have been talking about that across the world. So Hawaii is no different. So what's your thoughts, Doc? What's your thoughts? And if you don't mind introducing yourself real quick, I don't want to
Yeah.
misstate anything. I know you're with UH, but what do you do, bro?
So I'm Lee Altenberg. I'm adjunct professor in both mathematics and information and computer sciences at UH Manoa. So my field of research is mathematical models of evolution and how things change in populations. So viruses propagating through our human population is just one example of the kind of phenomena that I model and try to understand. So back in February of 2020, when we were first hearing about this coronavirus, I was warning my students, this is going to be a really huge deal. And they said I was the only professor that was talking to them about it at that time. But the thing is, I live 24/7 thinking about exponential growth, and so I knew what the numbers meant as they were starting to become clearer, and what the spread meant. And so I benefited from my research experience in knowing what the implications of these numbers were, and that this virus was going to go around the world and was going to be very difficult to stop. And it had a high enough lethality that people couldn't just explain it away. So that's a little of my background. So my technical field is theoretical population genetics, and I'm one of only two people that do that in the state of Hawaii.
Wow. So, Doc, I'm just gonna ask you straight up, man.
Yeah.
Because we see the numbers go up, numbers go down. We know there's an issue with testing. We know we're not testing as much as we used to in the past. But are you concerned? Are you concerned with what's happening here in our state?
Yes. I mean, so what should be painfully clear by now is that all the variants that we heard about in the news are getting here. There's a few new ones that are taking a while and that haven't gotten here, but all the big ones are in Hawaii. So how did they get here? Because all of these, nobody even knew about them before October 15th. And after October 15th is when the Safe Travels program came into effect. And not everybody was quarantining. All travelers used to quarantine from the governor's proclamation back in March, as I recall, until October 15th. And so then we switched to the Safe Travels program, where people would get out of quarantine if they got a test before within 3 days of their travel and a negative result. So that was supposed to make travel safe and protect the population from infected travelers. So then how did all these variants get here if we were being protected by this pretest? So obviously they penetrated it. The pretest was not stopping them, and they got here and they infected residents, and then those infected residents infected other infected residents. So all we can say that the pretest delayed the arrival of these variants, and that's really important because that gave us time to try to catch up with the vaccination. And so here we are, and the latest arrival is the P1 variant, which evolved in Brazil. It evolved in this section called Manaus, a city in Brazil, where they had thought that basically everybody had gotten infected, a huge rate of infection, because they hadn't been implementing these non-pharmaceutical interventions to try to stop it. And so they thought that Manaus, Brazil had achieved herd immunity. So this is this herd immunity that we're all looking forward towards. And they thought it was POW in Manaus, the pandemic. And then there was another eruption. And they discovered there was a new a new variant they called P1, and that it was infecting people that had already been infected, that were supposed to be immune, but they weren't immune to this variant. And this P1, they tried to estimate how fast it was spreading, and they found that it was between 1.5 to 2.5 times as infectious as the old variants. So again, so from a mathematical point of view, that's horrendous. That's monstrous and rate of amplification. So suppose your mortgage rate, somebody was going to charge you 2.5 times the interest, you wouldn't be very happy. So that's essentially what this P1 does. So it spread throughout Brazil, and now it's spreading so fast that it's shutting down their health system, overwhelming their health system. And it's spreading around the world, as all of these variants do. And now it's established itself up in Canada. And there's thousands of cases of P1 in Canada just in the past month. And so how it got here, we don't know yet. If you look at where it's most frequent among the passengers that are arriving in Hawaii, I would say Canada is a likely candidate. So it's here now, but it's in small numbers from what's been measured. What was it, 2 on Kauai?
One. Yeah. One.
So when it's that small, so the way this coronavirus spreads is there's a high chance that if somebody's infected, that they don't transmit to anyone. But there's also a significant chance that they spread it to like 10 people or 20 people in these super spreader events. And so any small number of infections, there's a good chance that it's going to die out. But once you get to a certain threshold, certain number, that chance goes away, and you're stuck with it. And so so I think we're at that point with the UK variant, the B117. It's now in large enough numbers and large enough fractions. I think the last I saw it was like 16% of the cases on the Big Island, that I think we're stuck with it in Hawaii. And it's going to become the predominant variant in terms of numbers. And unless it's unseated by P1, unless P1 gets established. So if people are really careful and the contact tracing is good enough, there's a chance that P1 could go extinct, and provided that we don't get any more infections coming in from travelers. But I think my best guess is that P1 will become established here, and that it will start spreading rapidly. And how many cases it turns into, it's hard to say, because it is a race. It's a race with the vaccinations. And it depends critically on exactly how much more infectious it is. So if it's twice as infectious, I don't think we have much to worry about. If it's 2.5 times as infectious, it could go into the hundreds of cases a day by the end of June. If you plug it into models and just plug in what's known about the virus, how fast it replicates, what the background replication number is in Hawaii. And I think why is Hawaii one of the best? It's the best in the country in terms of cases per capita, right? At the moment. So and I think that is just a credit to the residents of Hawaii and how careful they've been. So and keeping that reproduction number down. The problem is, even if your reproduction number is less than 1, in which case the virus would die out if nobody was coming into Hawaii infected. Even in that situation, when you have a steady stream of infected people, the community can still spread it and amplify it. And so you get a situation where you don't see much in your testing. You don't see many travelers having tested positive for it, but you see this community spread. But that can all be caused by the steady stream of infected travelers. So this is something that's not obvious, but when you look at the dynamics of it, look at the mathematics of it, this becomes quite clear. So, for example, suppose that Hawaii, the residents were so careful that the virus would die out on its own. And so suppose that every person infected, so it's like 10 infected residents infected only 9. And those 9 infected only 8, those 8 infected only 7, etc. It would die out. But if 10 infected travelers come in and then they infect 9 residents, and those 9 residents infect 8 residents, etc., you end up with a total of 90 cases of community spread for every 10 infected travelers. And that's in a situation where the residents are being so careful that the virus would die out here on its own. And in fact, that also is a situation where the population has achieved herd immunity. So even when we have herd immunity, if we get a steady stream of infected travelers, we could have 10 times as many infections as the number of infected travelers. So,
let me ask you a question. Given what you've just said thus far, there is probably a likelihood that what we're discussing right now, the common traveler coming into Hawaii don't even think about that kind of stuff. So they wouldn't even know if they were participating with this calculative spread or not. So that makes it problematic in and of itself, correct? That's one. The second part to my question is, when the P1 was first discovered, was it already on the books, or was it something that it was discovered and then it went out to the entire world? So anyone that does genome sequencing would know what they would be looking for. Because if it was never in Hawaii, I'm just wondering, unless our people from the state lab have been to someplace that's seen the P1 before, how would they know what they'd be looking for?
Okay, so fortunately, a lot of countries are doing full genome sequencing. So it's like 30,000 of these chemicals in a long string that make up the virus genome. And so basically, if you get infected with COVID, then about a third of the viruses that you're producing are not identical to the virus that infected you. They've got a mutant. They've got a mutation. Yeah. And so, but most of the time, the mutation is either hurting the virus or doing nothing. And so, but that allows you actually to track it. It's like a fingerprint on the virus, so you can see who got it from whom. Mm-hmm. And I'll show maybe later if I show some slides, we can take a look at what the results
before you
are.
Before you go explaining that, I know some people are writing in, they're hearing this ticking sound. Folks, it appears
from my sound?
No, not. I think it's coming from Facebook, and it only ticks, I guess, when you're talking, because the captions, we have automatic captions now. And the automatic caption is like it's typing. Then when you stop talking, then the tick will stop ticking. But it only ticks when the caption. Yeah.
It's only ticking when the doctor is speaking. So it's
that's right. Yeah.
So so it's not the caption, because otherwise it would be ticking when you spoke and I spoke. And
no, but I think it's coming from his feed. That's what I'm saying. The caption on his feed.
Maybe a hardware problem. Tell me, are you hearing it now? Are you still hearing the clicking now? Because I monkeyed around with my connections and
no, it's not.
It went off.
Okay, let's hope that solved the problem.
Okay. All right.
So that's a lesson. All right. So something's going wrong. Somebody out there in Facebook land is hearing something going wrong, and they report it to you, mm-hmm. and you hear it, and then you feed it back to me, and then I try to solve the problem, and it looks like I solved the problem.
Yeah, you did.
So that's the loop. That's how the loop of how we fix things. And I think what's really important is to realize is the loop of how we fix things in our COVID policy is not working in Hawaii. All right.
Exactly. Okay.
And because lots of people are reporting the problems of the Safe Travels program, but it's not being acknowledged by the leadership, nor is it being highlighted by the press.
Mm-hmm.
And so if you look at all the stories, so if you remember the HB 1286, the House bill that would make the Safe Travels program the law of the land through December and not allow the governor to change any kind of quarantine policies. So that bill generated a lot of press and concern. But if you read all the newspaper stories about that House bill, none of them talked about the variants.
Right.
And if you read the newspaper stories about the variants arriving here, none of them talked about safe travels. There was this disconnect. It's like something is, there's some block in the brain of the press that's not allowing the issue of quarantine policy to come under scrutiny. And that's really dangerous. So that would be if Facebook was censoring all the comments that said my voice was clicking and you guys couldn't hear about it and I couldn't respond to it. Well, the same thing's going on in the news coverage of the variants and the new how that relates to our quarantine policy. Nobody's putting two and two together and nobody's questioning the leadership about it. And I think that's a really huge problem.
Well, we had Dr. DeWorkin on a couple of weeks ago and spoke about all the different studies, whether it was all the different tests or studies that were done with testing and he made a comment. He said, the real world test or the real world scenario was Kauai, right? October 15th, 2020, we entered safe travels. Our numbers went from 0 and 1s to 13 and 18 or whatever it was, right after we opened safe travel. So I remember him saying, we will see what happens when Kauai rejoins safe travels. And lo and behold, safe travels opened up on the 4th it was, or whatever it was, and we're up to 22 cases already from what we had 0. And now we have the variant. So you're exactly right, Doc. And that's what frustrates Charlie, myself, and all our viewers is that if you watch the news, if you watch the morning news, I won't mention names, but there is one guy that's on the news every morning on KHON, and he talks about COVID. He talks about how well we're doing and how expect the numbers to drop by mid-May because that's what's going to happen. And that's not going to happen. We have variants now. And like you said, there's no mention of that. There's no emphasis put on the variants. There's no emphasis. Everything is about how wonderful we're doing. We're going to reach herd immunity. Now we're finding out we're in that demographic that doesn't want to take the vaccine or not taking their second shots. We hear herd immunity now is moved up to 90 to 95% of the population. So it doesn't, but you don't get that from our leadership. You don't get that kind of concerning discussion or real discussion from our leadership. It's all nice. And I remember from the beginning we said COVID doesn't operate on a timeline. And we cannot treat it and we cannot do things based on dates. Because this virus has a mind of its own and it's going to do what it does. So yeah, it's concerning. And I'm not sure how we get that word across to leadership.
Well, I mean, the vaccination is the main thing that's really changing on the ground, the level of vaccination. And if you were to tie policy to the vaccination level, that would ground you in the reality of what's changing. So I'm trying to read about what is going on in India now. It's tragic, the explosion of cases there. And then as far as I've been able to understand it, they got their numbers really low. And then their leadership basically said the pandemic's over in India and we can relax and go back to normal. But nothing had changed on the ground, that there was no greater immunity in the population because they haven't had the vaccination rate that the United States has had. And lo and behold, they relaxed it, and the cases exploded again. But now they're being driven by the big menace in India right now is the UK variant B.1.1.7. That's what's driving it. And so everything that you did that was good enough on the old variants is not good enough now with the new variant. So if you think about the herd immunity is also equivalent to like our error rate. All right. So with the original coronavirus variant, herd immunity was like 60, 70%. That means we had a margin of error of 30 to 40%. So that would be 30 to 40% of people could be unvaccinated or not wearing a mask, or, basically missing all the precautions that would protect us. Now, when the California variant gets here, that's 20% more infective. That squeezes our error rate down to about 30%. All right. That means we can only have 30% of the population unvaccinated or not wearing a mask, or making errors, if you will, to keep the virus at bay. Now, when the UK variant gets here, that shrinks it down to about 25% because it's 50% more transmissible than the old variants. So that means our margin of error is getting narrower and narrower. And that has to include all the unvaccinated people and all the people not wearing masks, et cetera, et cetera. The P1 variant, if it really is 2.5 times as infectious as the original variants, that squeezes us down to a margin of error of 15%. That means if more than 15% of the population are unvaccinated and not wearing a mask, or otherwise not being cautious, then the virus keeps growing. It keeps spreading. So if we were just down to the original variants, the pandemic would almost be over now in Hawaii. I mean, the whole state would have been like Hawaii was before going back into safe travels, and it would have been sort of like the country of New Zealand, which has been able to go back to normal life, having huge stadium shows, sports events, with nobody wearing masks. So as far as I remember reading it. So but the proportion of their economy that's tourism is much smaller than ours. And so we're kind of like a turtle that's been attacked by a shark, and it can go into its shell and protect itself, but eventually it's got to breathe. And that's eventually that Hawaii has to let back in visitors for its economy. So I think the problem with saying everything is fine and the Safe Travels program has worked, and that going a quarantine like Hawaii would to quote the Lieutenant Governor, kill us, is that we're not exploring alternatives in the realm of quarantine policy. So there's a lot of ideas besides just locking everybody in a hotel for 2 weeks. And one of those ideas that's very interesting is the Hale Hawaii idea of the Safer Travels program, where people are quarantined to the outdoors. And so we're supposed to be getting an announcement from the CDC tomorrow, perhaps, about a change in mask policy for people outdoors. So you're much less likely to catch COVID from somebody when you're outdoors and the air is constantly being changed, and you're not in their face.
Well,
so yeah,
this is the, and I'm sorry to interrupt you on this, and it's interesting what you just said, but I find it very, very interesting because when we change policies, or when we change guidance that's given by the CDC, for some reason, and I don't know if I'm dreaming this stuff up, but it appears that, say, if the mask wearing changes a little, it says it's perfect. You don't need it outdoors, but you need it indoors. but yet people are still, if they start getting accustomed to it outdoors not wearing, it follows them going indoors, and then it becomes a problem. That so-called that DMZ, that line, when you're stepping over that line, it just doesn't kick in to say, okay, put on your mask, because they're following the rules from the outside. And that has always been the problem that Mel and I, we discussed this before, that when a certain message is given, there's always caveats, right, attached to the message. So we tell people, listen to the whole message. If you're only reading the front end, the back end is saying, actually, you should take precautions. And then it follows them wherever they go. And then we get this problem. Do you think that's one of the things that we should be looking at as
Yeah,
well?
well, I hope they come up with a uh, sensible policy tomorrow, because just as you're saying, if people think, oh, well, the pandemic's over, I don't have to be careful anymore, that's really bad.
Right.
So let's hope they do a nuanced job on that. So on the one hand, some people think it's ridiculous to have people wearing masks outdoors because it's so much less dangerous out there, and that people will recognize that's ridiculous and they will disrespect the government agency that's making that policy. And so that's on the one side. The other side is just a simple rule that wear a mask when you're in public is easy for everybody to remember and follow. So, I don't know where these chips are going to fall in this case. One thing I can say is that in all the time that Kauai had days and days of zero cases, if you looked at their mask wearing rates compared to the other counties, they were the worst. They were in the 80s, because all the other counties were up in the 90s. And that makes perfect sense. If there's no COVID around, you're not going to be as careful. But now that situation has changed, people have to adapt and protect themselves, because the quarantine was protecting Kauai all this time, and now that's gone. Your force shield is suddenly disabled,
Right.
and so let's hope that people will quickly catch on that they'd better start wearing a mask to protect themselves in Kauai. But obviously, the people that blamed the community for the case numbers, they were probably blaming communities that were where the virus would die out on its own if it weren't for the spread of infected travelers. And so, of course, when you look at a case and you see how did somebody get infected, you're going to find that they weren't wearing a mask, that they were gathering together when they shouldn't have. And so all the cases that people get are going to be, you're going to find that they're some kind of violation of the protection policy. But trying to blame the people as a whole when it's all due to the steady inflow of infected travelers is misplacing the responsibility. So, this is one thing. This pandemic experience is something that none of us have ever lived through, and where we are confronted with the reality of a stochastic exponential process, all right, which nobody has much direct experience. And so it's hard, the logic of it, how we reason through what is causing what is a challenge, okay? And so, when somebody gets infected, obviously there were particular conditions that cause that. But when you scale it up to a population, then the persistence of an epidemic is no longer just an individual matter. It's a matter of the behavior of the entire population, the connectedness, all of these things that are not individuals at fault, but it's a collective. And so now Kauai, we had one experiment, and when it started in safe travels and pulled out, the cases went up, the cases went down. So now, unfortunately, we have a second experiment on real human beings. The cases were down, and now the cases have gone up. So at this point, I don't know how anybody could argue that safe travels is protecting the population from infection. So early on in the pandemic, there were policies being circulated around for consideration about how are we going to manage our protection policy for the state of Hawaii. And one of the ideas was it would be based on not overwhelming the hospitals. And so they would try to allow as much business, as few restrictions as you could get by with, and not overwhelm the hospitals. So that, I think, is not a good policy. There's ethical reasons that's kind of abhorrent. But in terms of not overwhelming the hospitals, the safe travels has been a success in that all this time the hospitals in Hawaii have not gotten overwhelmed. But I think that's the only measure that you could say safe travels is a success. The other is, so you've allowed, what was it, 2 million visitors and not overwhelm the hospitals. But a lot of people have died who wouldn't have died if the quarantine had persisted. And I think at some point there's going to have to be a discussion about that.
And that's why, Doc, it really upsets me and frustrates me when we hear, yeah, but the hospitalizations are low. Yeah, the deaths, we heard the Honolulu mayor say that he's not concerned about the case count. He's concerned about hospitalizations and how many people die. And it's really, almost like saying, we know that smoking's bad for you. You can continue to smoke until we find out you got a spot in your lung, and then it's too late. It's same like COVID. What are you waiting for until it gets to a point where we cannot control? I mean, this thing runs away from us real quick. We went through this before. So the whole safe travel thing, we've called it from the beginning. We've said it's an unsafe travel program, and like you said, there is no way anybody can dispute the fact that it's not safe. Kauai is living proof. And they will tell you that while the demographic of the traveler to Kauai is different, ain't no different. COVID don't care. And we're seeing it live again here on Kauai. I'm not sure what part of that they don't see. I understand their commitment to the visitor industry. I understand that. But how do you tell a family that lost a loved one that, yeah, we could have done better, we should have done better, but by then it's too late. And I thought Kauai had a great program. You had a bubble program. You come in, you stay a couple of days, 3 days. That we found out was sufficient. We didn't have to put them on quarantine for 10 days. We could do a 3-day, 4-day quarantine. And they could roam the property. As long as they didn't leave the property, they could go do the pool. They could make appointments to use the gym. But no, that wasn't enough for our leadership. They wanted to end all quarantines. And that I think was a mistake. And I think it's a mistake that we're going to pay for in the future. But I don't know how else to get the point across.
Well, I mean, it's a reality that Hawaii has by policy gone for the easy money, which is tourism. And it's made itself dependent economically on it. And that this sudden drop in tourism is something that's hurt a lot of people and economically, and the state wasn't prepared to protect them from. That's a reality. So, but what's bad is that the ethics of these trade-offs they're being covered over in the discussions. And when you have to make hard choices, you need to be honest about what your considerations are, and not just try to say, that we solved the tourism problem and it didn't cause a COVID problem. That's not an honest way of dealing with it. Now, if you look at the travel numbers, Kauai, with its bubble program, had really small numbers of visitors compared to what it's got now. But the thing is, its policy was competing with the lax policies of the other counties. And so we never had a chance to say, what if all the counties in Hawaii had the same policy as Kauai? What would the visitor counts have been then? And they might have been, maybe they would have been as low as what Kauai had, or maybe they would have been exactly what they've been with the safe travels. It's hard to know, or at least comparable. And I think the problem is that the state has not been exploring the full space of policy alternatives by how it's locked into its rigidity of this pre-test and release from quarantine. So we may, because of the rate of vaccinations, be able to avoid major catastrophe with the UK variant and the Brazilian variant. It depends. It may get away from us, especially if vaccine hesitancy slows down the rate of vaccinations. So I could show some slides from models if you'd be interested.
Hey, Doc, I'm not sure.
Yeah.
The ticking sound is still there. Are you hearing it in your headpiece?
No, I'm not at all. It's
Huh.
still there, huh? What could I do? Well, let's see. Let me try an alternative here. I switched to an internal microphone. How is it now? Is the sound any better?
Yeah, I don't hear the ticking now.
But you can hear me clearly?
I hear you clear.
Okay, well, let's go with that. And let's hope that this holds out. Sorry about the clicking.
No problem.
I don't know. It's,
It's Facebook.
So as you're looking for those slides, Doc,
Yeah.
let me ask you one more thing. A question was posed regarding virus and variants. Do all viruses have variants?
yeah, that's just evolution.
Okay.
And so, what determines how much variance there are is just the mutation rate of the virus, how accurately its genome sequence gets replicated in the viral infection. And so
we talked about if this thing gets away from us, given the population of Hawaii, what is the threshold do you think in your estimation? What is that threshold? Let's take Kauai, for instance. We're close to 80,000 population base. What numbers should we be concerned about when we're seeing that? Oh man, it's because just using hospitalization, we'll probably never ever see it. Because it's almost like we're going to be waiting for something to happen. But as the numbers increase in the meantime, what would that threshold be for Kauai as an example?
I'd say follow the case numbers. If the case numbers are growing and growing and growing over a whole week, then you've got trouble. And we're only getting these variant reports about once a month. That's way too slow to really keep track of it. And frankly, I don't know to what end the Department of Health is doing these, because it's not resulting in any policy changes. So it's like, oh well, we got the California variant's here. Now the UK variant's here. Now the Brazilian variant's here, and now they're growing in numbers. Now the California variant's dominated Hawaii, but there's nobody says, if this happens with the variants, then we need to do this and such. And that seems to be a strange thing. So, we don't know what actions there are being considered. Now, to me, the obvious action is restore some kind of a quarantine to travelers to keep these variants out. But that seems to be a taboo subject. None of the leadership and none of the newspapers talk about that possibility at all.
Mm-hmm.
Well, that's because the leadership is focused on now allowing travelers to travel without a test, as long as they're vaccinated. That's going to happen next month. In a couple of weeks, 3 weeks, we're gonna have inter-island travel, and if the leadership gets their way, that will be extended to local residents that are traveling trans-Pacific, and then to trans-Pacific travelers. And on the lieutenant governor's thing this morning, his little piece that he has every morning on the news, they asked him about that, and he said that only 1 in 20 people, 1 in 20 vaccinated people can get the virus. Now, I question that. I'm not a doctor, doc, but from all what I have been listening to and reading from experts around the world, that may not be necessarily true, that only 1 out of 20 vaccinated people will be able to pick up or transfer the virus. I don't know if you've read or studied this, but we just don't know right now. Am I correct?
Well, the numbers I've seen, the only number of 95% that I've seen with regard to the vaccines is prevention of disease.
Yeah, prevention of hospitalization and or serious illness or death.
Yeah, but in terms of
I
prevention,
have not seen one expert or heard one expert tell me, except for Josh Green, who I don't consider an expert, that only 1 in 20 can get the virus and transmit the virus. And that is simply not true.
the best I've seen is that the mRNA vaccines, the Pfizer and the Moderna, reduce the rate of becoming infected, asymptomatic or symptomatic, by 90%. Now that's really terrific. But they're still trying to get estimates on what they are for these variants, excuse me. So the P1 variant, it's believed that it's less than that, maybe only 75% effective in preventing infection. But now then, in terms of how transmissible, so it may reduce how much virus your body is producing as well. And so the total effect of it on infectivity may be good, but we don't know. So I mean, I think so with regards to the variants that have gotten here, I think we're going to see an increase in their numbers. But if we keep up our current rate of vaccination, it's not going to get like in the hundreds per day. If we fall behind, and if the vaccinations go back to what they started out with, that's a real possibility. Or if just vaccine hesitancy creates this big chunk of the population that's not vaccinated, then that could really be heavily invaded by the P1 variant or the UK variant. So I think it's possible we might get away with the current variants and not have an explosion, but I think it's possible that we could have a large outbreak within what's known about these variants, and we're going to have to see. But I think the real scary thing on the horizon is a variant that renders our vaccines useless. And myself and lots of other epidemiologists expect that the coronavirus will evolve such a variant in the coming months, and at which point, when it starts to spread, the vaccine companies are going to tweak their vaccines and produce a booster. But then we're going to be basically waiting for that booster to arrive. So what do we do in the meantime? Suppose there's an outbreak of a completely vaccine-resistant variant in San Francisco, with the rate of flights coming to Hawaii from there. That's a point where we might need to really get serious about keeping the variants out of Hawaii, where it's obvious the safe travels would put us in hot water very quickly. And so that's why I think the state needs to be prepared to look at alternatives to the safe travels and that allow some visitors to arrive, but in a way that's truly safe. And so Kauai has proven that that's possible. All right. And if the whole state had Kauai's policy, I think it's it's possible that we would still get a large visitor number. All right, that 3-day bubble quarantine is not so inconvenient that it would stop the mass of people from coming here. That remains to be seen. That it's something that needs to be tried. So that's kind of the big picture as I see it. If a really scary vaccine resistant variant emerges, where that renders all of our vaccination basically back to square one, then we're like we were back in March of 2020, and we need to have some kind of policy that allows visitors but truly keeps the population of Hawaii safe. And I think it really behooves the leadership to put some hard work into exploring those policies instead of just saying safe travels works. That's kind of like my bottom line for thinking going forward.
So,
Yeah.
so with regards to, and you mentioned this earlier regarding the variants, because I had asked, how is this creation? So I guess if something was to brew in the pot here in Hawaii, it would have a variant named after Hawaii. I mean,
Yeah, if this was the first place that was ever discovered. Yep.
Right. So these numbers now, there must be a number on this panel that the experts can look at and say, hey, if we were to do a model, and if this variant was to come on scene having this would be the model that would show that it would be totally resistant to any vaccine. Would they be able to do that right now? Just to
Sure.
give a heads up warning?
Yeah.
And is there any reason why they're not saying anything about it right now?
I don't know. So I don't know what kind of modeling they're doing in the Department of Health or
Okay.
in any other agency of the state. So I worked on my own models. There's Professor Monique Shiba has a research grant for trying to do detailed data-based models, incorporating as much detail about the Hawaii population as possible to try to make predictions about the course of the epidemic. And there's the sort of group of us UH faculty called the Hawaii Pandemic Applied Modeling Work Group that's been trying to do work on getting these models together. So I mean, our hope in creating this group was that the state would draw upon our expertise in reaching some of its policy conclusions. But they haven't been knocking on our door terribly hard. So yeah.
Okay.
Yeah,
Well,
I'm just reading some of the comments. Sorry, Doc. I'm just trying to catch up some of the comments that the questions that may be from our viewers, but there's just a ton.
How are we doing technically? Can you hear me okay now? Is the sound fixed?
Yeah, I think so. I'm not hearing it, but I just want to say, in our variant case that we identified in today's on Kauai was a visitor that flew in, had the negative pre-test, and a few days after arrival got tested and tested positive. And of course, that sample was sent to the lab for the sequencing, and it was determined to be the variant. So, I'm concerned that as we move forward in this opening up, yeah, I know there's someone on the thread that doesn't think that COVID is an issue. That in fact, 500,000 people is no biggie. Well, it is a biggie. It is biggie. It is a big, Jack. It's big, and maybe I don't know. Charlie lost his brother to COVID. I lost a cousin. I lost a friend. Many of us here have lost loved ones. So it is big, and we're not being hysterical. And if you think this is a waste of time, then you can go watch somebody else's show, Jack. We're not here to make anybody scared or be hysterical. We're here to get information from experts. And unless you can provide some expert proof, be professional with your comments, and please do not minimize COVID. Do not tell me that 500,000 people is nothing in the big picture, because apparently you haven't been touched by it. And good for you. You've traveled for a year without getting sick. God bless you. You're lucky. Many don't are not lucky. All right, and we're not being hysterical. We just do not want to create a safety issue for our people. So anyway, consider that a warning, Jack. Consider that a warning. I usually don't give warnings, but I'm in a good mood tonight.
Let me ask the doc a question again. So we've got this situation with variants. So today I took a look at the P1 and where it's prevalent in what states. And the largest right now is in California, the P1. They're moving across, just by the numbers that the CDC tally. You go all the way to Pennsylvania, Tennessee, Georgia, Florida. Then you go up north, you get Michigan, you get Colorado, you got Massachusetts. Do you think that at some time that if, number tracking like those telling us that, hey, these places are really popping up with variants, that maybe if they did, just like what countries did in holding off and allowing American travelers, tourist travelers, to go into their country until we could bring things under control, right? So now we can see that certain countries are now opening their borders to American travelers because they feel maybe a lot safer that because of the vaccination process. Do you see something like that over the horizon if these variants aren't controlled from who we know as most predictable travelers to Hawaii? Because I would think that if someplace that is very a hotspot, maybe they're vaccinated, but again, we get no way of verifying it. That's why they're not allowing that type of trans-Pacific traveler until we can actually hop onto some kind of validation process to see if they have been vaccinated or not. Do you see something like that coming over the horizon?
Well, that's a beautiful vision for a system for trying to control this pandemic, where you have really detailed testing and sampling of what the variants are and where they are, and then you control travel based on that. But I don't think the United States is anywhere near contemplating such a system. So there are, there's very crude international travel controls, but as we've seen, the virus can spread so easily with air traffic. It's just like it's like a wildfire and cinders raining down all over the place. So there are people are developing technology and trying to deploy it that is like the PCR test, the nasal swab test that can instantly tell you what variant you have without having to do the full genome sequence. So, this we should have been ready to deploy this months ago. But again, we're behind the 8 ball and dealing with this emergent twist in the tail of this pandemic.
Hey, Doc, we got about eight minutes left. I know you mentioned that you had some slides.
Yeah.
I wasn't sure if you wanted to go ahead and put that on real quick.
Let me share the screen here. And
again, we really appreciate you spending your time with us, Doc. Again, for our viewers, this isn't scripted or prepped or nothing, man. Doc comes on and I feel sorry for our guests sometimes because they always ask any questions that I should be focusing on, and my answer is always the same. Nah, it's just an informal program. We just all right.
The most terrifying words are informal program. Okay, so here's plugging in the numbers that we know about the P1 variant and guesses about the current population. And here's a model of the number of variant cases given the different rates of vaccination. Okay, so this is assuming one infection of P1 on April 6th, and where P1 is 2.5 times as infectious as the old variants. and that we have a reproduction number for the old variants of 0.9. So that's a level, that's basically herd immunity. Okay. So the blue line is if we had 10,000 vaccinations a day. And then it would show that by late July, getting a peak of about 180 cases a day of the P1. Now, if we go to the orange line, that's 12,500 vaccinations a day. And then it's a very small, much smaller outbreak. And then if it was 15,000 vaccinations a day, it's pretty low. So that's assuming that there was one infection on April 6th. So suppose we had 10 infections on April 6th. Then our blue line, our 10,000 vaccination numbers a day, it's not looking very good at all. It's over 800, it peaks at over 800 cases a day. And then the orange line at 1250, which is closer to what we've been doing lately, it peaks at about 200 cases a day, but it doesn't peak until July. So all through April, we can barely see anything happening, and then it starts to increase in May, but then it really hits the fan in June. So these are things that you can't just get an intuition about. You need to plug it into a model and see what happens. So, but now suppose that these worst case estimates about the infectivity of P1 were not as bad as it really was. Suppose it was only 2 times as infectious. All right. Then even under our low 10,000 a day vaccination rate, we only get up to 40 a day. So starting with 10 infections on April 6th. So the take-home lesson is, within the realm of possibilities, there's something that's of very little concern or something that's really bad, like this case. The problem is we don't really know how many actual infections of P1 there are in the community. We have I think it's a total of about 8 have been actually sampled now. But our sampling is only a small fraction of the actual infections that are out there. So we don't really know if this is the actual situation, and that we're going to be in store for triple digit numbers of infections in June. So this is something to watch out for. This is a scenario that we can't exclude based on our current data. So that I'll put it like that. So it could be we get nothing, like this, or we get something really dire. These are still all within the realm of possibility with this P1 variant here in Hawaii. So I don't know if that's helpful.
Okay, so why you got that screen up there?
Yeah.
Looking at the worst possibility that you have, what you're showing there right now. What the take that I get from it, that means that you got to have all hands on deck ready to take this monster on head on, right? I mean, that's the only thing you can do, because at 800 plus, you might as well not even think about hospital beds or anything like that, because you just, everything is just, all hell's going to break loose. So I would think now that the state would have to deploy at least the resources as far as the medical care workers to start ramping up if this starts to show its ugly head in the next couple months, right?
Yeah. So I think, I mean, the tool of last resort is the stay-at-home order, the lockdown order. And so we can go back and look at how the state did when under our 2 previous lockdown orders. So here you can see the light blue area is our duration of stay-at-home orders. And you can see there it was growing high back in April, and then we had the stay-at-home order and it dropped way down. And then back in August, or the end of August and September, the numbers were getting, peaked at 350 a day. And we had the stay-at-home order, and they brought it way down in a space of about 10 days or 2 weeks. It was a 14-day order. It brought the numbers in half. So that's a a last resort that the state could employ if the numbers really start to go out of control. And I think they would have a similar amount. So we can look at the reproduction numbers. So back at the beginning of the pandemic, if you fit this exponential curve to it, the R naught value before we were trying to do anything about it was 2.2, and that's pretty close to what people estimated for the coronavirus. Then after the first stay-at-home order, it dropped to 0.66. So that's a 70% reduction in R that we were able to achieve with a stay-at-home order. And so that measure, I think, would be good enough to protect us. That combined with vaccination against an outbreak. So the real question is, in a sense, what the leadership were making a gamble on was that we could have all these tourists and not overwhelm the hospitals. And in case they started to get overwhelmed, we could go back to another lockdown, but that hopefully we wouldn't have to. And that wager, that bet might still work out, but it remains to be seen.
Yeah, I get the sense that that the state is just basically rolling the dice and hoping. And I remember Senator Mercado Kim on our show saying, and I'll never forget this, hope is not a strategy. But I think that that is their strategy, that they hope that it'll take care of itself, that they hope that the numbers will drop and that the hospitalizations, they keep reporting on the hospitalizations statewide, and it's a very low number. But what they don't tell you, and we have Charlie and I, and probably you, Doc, you probably know this, we have a lot of friends and resources that work in the hospital system that are telling us that the hospitals are filling up, maybe not with COVID patients, but with non-COVID patients, with surgeries and accidents and other things. So it's not just based on the COVID number of people in the hospital. It's capacity and where we're at, because if we should get a surge, and I hope we don't, but I don't see how we're going to get around that. Then what do? We don't have enough beds, and then it's just another crisis again. And even a lockdown's not going to take care of that. It'll slow down the numbers, but what do you? You got sick people that need to be treated with specialized care, and I'm so concerned, so concerned.
Mm-hmm.
Well, did I leave any big questions unaddressed that you had for me?
Let's see. Wait. You can stop sharing, Doc, if you're done with the slides. The one question that just popped up when you asked, if someone is vaccinated and gets a COVID positive on a variant, is it possible to get infected by another variant?
Well, that's the whole thing about P1, is that it's infecting people that have been previously infected by the earlier variants.
Mm-hmm.
So it just has to have evolved far enough away from the old one to evade the antibodies and the T cells from the previous infection. So it's possible. So I mean, really, the vaccine is not making anything impossible. It's just changing the probabilities. And on a population basis, that's what you need to do to stop the pandemic. But I mean, the rest of the world doesn't have the access to the vaccines. And what's going on in Brazil and in India is really tragic. And so this whole year might be really just the first wave of this virus, and what it's going to evolve into, we don't know. And so it's not cut and dried. So I think, given the players that are on the table right now, if we keep vaccinating at the rate we're vaccinating, we'll be able to keep out any major outbreaks in Hawaii. But new players are coming onto the table all the time because of the variant evolution. And so it's really the future of the next year, I'd say, is pretty unknown.
Hey Doc, you know, when someone gets the virus, then your body develops the antibodies, right? Supposedly. Is there any study underway to show that if someone gets the P1, if it creates this super antibody? Because it seems to be the variant of the boogeyman. I mean, you know, you got some variants that go, okay, you know, you got the dominant California variant, but it doesn't seem like it's really causing that much concern. You know, people are just taking it in step. But then when you talk about the Brazilian or now the BV one, you know, they're talking about that, the one from Texas or wherever supposedly that is. It puts up these alarms. Do you think it creates antibodies within the human body to be like ultra powerful? I mean,
Oh, well, no, I mean, there's
or
nothing.
it's all standard. It's all standard across the board, the same.
Yeah, I think probably so. So I mean, the P1, why is it so dangerous? Well, because it's so transmissible. That's the main one. I don't know. I haven't been able to find any studies of if it causes any more increased mortality. Now, the UK variant increases mortality about 64%.
Wow.
And sends people to the hospital at the same rate. So it's a really much more dangerous. We don't know about the P1. I mean, it's doing horrible damage where it's landed, but it's mainly because it's more transmissible. So, but the body, you know, does the same thing to deal with all of them. It finds an antibody that manages to stick to the parts of the virus and label it, and then T cells come along that have their own labeling system and then devour the virus and devour the cells that are infected. They're a little bit more generalist than the antibodies. So that's why I think some of these vaccines have done pretty well with the variants so far. But the immune system reaction is pretty much the same for all the different variants. It's just a matter of getting it in time and the contagiousness, to my knowledge. Okay. Yeah.
Well, I guess we just gotta wait and see and roll with the punches. And again, I think policymakers got to start listening to science and being safe to protect the people. So we just got to wait and see. And I know many experts have said prior to the variants exploding around the world, I've been hearing experts say for a while now that the next wave of COVID is going to be made up of variants and not COVID. And you know what? That's exactly what is happening now. So we're just going to have to wait and see. So, Doc, it's 8:07. We appreciate you hanging on beyond the time. Is there anything you want to share with our viewers before we?
Yeah. So, I mean, if the institutions are not giving us what we need, we can at least take measures to protect ourselves, and just avoiding gatherings, avoiding being indoors, and getting a good mask that fits. Now you can get N95 masks, you can get them on eBay, and they offer the best protection. So that for individuals fending for themselves, that would be my top recommendation. Get yourself an N95 mask and wear it religiously indoors. And we may be able to really stop it, even with all these infected travelers coming in.
Thank you, Doc. Thank you, Doc. And of course, the N95 does you no good if you're not wearing it properly. It's not a chin strap.
Yeah.
Charles.
Thank you very much, Doc, for being with us tonight. Thank you for giving another very impactful talk and what we should expect, and your insight of what's the possibilities. Just keeping everybody informed. And to our viewers out there, thank you so much for joining us. We knew that this was going to be a very insightful presentation, and it's always great to have the doc on with us. And thank you for being so patient and understanding. And I hope you heed the warning he said at the very end, and that is we just got to continue to wear a mask and avoid the social gatherings and keep a distance and use all the proper hygiene. And I like to add one more thing in there, and that is you put on your mask or you take off your mask. Make sure you disinfect in between, because you'll never know. You'll never know. So thanks again, Mel.
Thanks, Charlie. That is so important. I see so many people, they go store, they touch everything in the store, and they're touching people now. I see the hugging starting to really increase. And then the first thing they do is they hammer a mask when they get in a car before washing your hands. And then you touch the mask, put them on, bingo. So just guys, we've been saying this for almost a year, if not a year, that it's going to take us to take care of ourselves and our loved ones and not rely on the state, not rely on the federal government. We got to do what we got to do to take care of ourselves. You see somebody without a mask, no go hug them, no go touch them, no go near them. Take care of yourselves, take care of your loved one, take care of your family, and make sure you do what you need to do to keep yourself safe. Doc, thank you again. Tonight I'm reading the comments, and there's a lot of amazing comments thanking you for a very amazing presentation. So thank you again, Doc. It's always a pleasure to have you on. It's always nice to hear real talk, and that's what you did for us tonight. So viewers, thank you again. We'll see you guys Wednesday night at 7 p.m. You guys stay safe. God bless. We love you guys.
Thank you.
Aloha.